Hey there, students! Have you ever wondered why patient autonomy is such a big deal in medical ethics? Well, it all traces back to a guy named Immanuel Kant. Today, let's dive into how Kantian ethics laid the foundation for the principle of autonomy in healthcare. Immanuel Kant is one of the most influential philosophers in Western thought, especially in ethics. At the core of his philosophy is the belief in human dignity. Kant thought that every person as a rational being has the capacity for self-governance. That means respecting an individual's autonomy by acknowledging their ability to make rational choices based on their own reasons and values. Now, Kantian ethics emphasizes something called the categorical imperative. This fancy term basically means that actions should be guided by universal principles. In healthcare, this translates to treating patients not as means to an end, but as ends in themselves, respecting their autonomy and dignity. So, what does autonomy mean in medical ethics? It ensures that patients have the right to make informed decisions about their own health. This principle is rooted in Kant's philosophy, where individuals are seen as capable of making rational decisions about their lives. In practice, it's all about informed consent. Patients must be provided with all relevant information to make decisions about their treatment. But Kant didn't stop there. He also introduced the concept of duty. For healthcare professionals, this duty means respecting a patient's autonomy, even when the patient's decision doesn't align with the healthcare provider's recommendations. This creates an ethical balance between professional guidance and patient choice. Now let's talk about dignity. According to Kant, every person has an inherent worth. This dignity must be preserved in all healthcare interactions. Healthcare providers have a duty to respect this dignity, not only through medical treatment but also in the way they communicate and support their patients. Intentionality is another key concept in Kantian ethics. An action is morally good if it's done from a sense of duty, not just to achieve some desired outcome. For example, a doctor should respect a patient's autonomy because it's the right thing to do, not because it might lead to a better outcome for the healthcare provider. So here are the key takeaways for week 13. 1. Autonomy in medical ethics is deeply rooted in Kantian ethics, emphasizing the importance of respecting patients' rational capacity for self-governance. 1. Dignity requires healthcare providers to treat patients as individuals with inherent worth, not as means to an end. 1. The principles of duty and intentionality guide healthcare professionals in respecting patient autonomy, even when it conflicts with medical recommendations. As you reflect on this week's concepts, think about how Kantian ethics continues to influence modern medical practices, especially in situations where patient autonomy must be weighed against professional duty. Thanks for watching, and see you next time.